suction first, because when you suction, you stimulate a cough. So let's say you did trach care first, and now you're going to suction. Now everything you just cleaned got dirty again. So it's always better to suction first and then do. I don't have any of you have a stethoscope? Is there a stethoscope over there?
I have one in my bag.
Oh, okay. Can I borrow, please?
They actually want us to suction because they want to make sure the trach is in place after.
Well, the times that you're suctioning because the patient can't cough up their secretions. So you need to give them a hand with these secretions, because the patient can actually have oxygen compromise if they have a mucus plug, and it's gonna consider like an obstruction. So there can't be any airway. No, there won't be no oxygen going into the airways because of this plug. So it's better to, you have to suction it out. Got to get that stuff out. All right. So let me make sure I got everything I need. So I'm going to check my packages. I brought both in when you guys do your checkup to have both. So this is going to be my suction catheter tray. I'm going to do the same thing with everything else. Look for any kind of integrity compromise in my package. This one is brand new, so I know that I have everything I need. You do need some saline to do this, because you're going to check your suction right before you suction the actual patient. Okay, so we verify doctor's orders, and we're going to come in and identify the patient. Mrs. Smith, I'm going to introduce myself. Hand sanitize and come in. Mrs. Smith, hi, my name is Sandra, and I am your nurse today. And the doctor has ordered for us to suction you, and I'm going to go ahead and do that procedure on you. Have you ever had it before? Trach patients really can't verbalize with things. So with your trach patient, they very likely will say, or they can write. So Mrs. Smith, she's been suctioned before, so I'm not going to go over the whole procedure with her. But if in case they told you, that's my first time, then you want to tell them what you're going to do. You're going to check for allergies only because we just want to make sure that we're always checking on. It's always best. We are going to do some cleaning. And Mrs. Smith, I'm going to also clean after I suction, okay? Is that okay with you? All right. So provide privacy. I had already hand sanitized, and I washed my hands, and I'm going to gather my supplies, and here are my supplies. So the very first thing, I want to make sure that the suction catheter I get is no larger than half the diameter of what my trach is. So this one here is a 14 French, so it's fine, and I'm going to assess my lung sounds first. So I'm not going to leave this patient like this. I want to have the patient sit up. You want them to be at least semi-Fowler's position, anywhere from minimal of maybe 60 degrees. And if they're comfortable enough, the higher the better. So I'm going to sanitize again, put my gloves on, because I'm going to touch the patient. Only thing, this one has sterile gloves. Okay. So I'm going to auscultate. Always auscultate under the gown. You don't want to auscultate over the gown, but at the same time providing some privacy. So I'm going to listen. Okay. Can you take a deep breath in for me, please? Okay, take a deep breath in. Okay, tell them to take a deep breath in every single time you're doing that. Okay, she definitely has a lot of bronchi, so she needs to be suctioned. She does. I even heard a S1, S2. All right. So now that I auscultated, I'm going to go ahead and grab this here. I'm going to check my regulator, which is this, to make sure that it works. So it has to be between 80 to 120 to suction, and I'm also going to pre-oxygenate my patient. And if they had a mask here, I would just go up on my meter, give them some pre-oxygenation, let that be there, and you at the same time you're checking your regulator, and it will make a sound like because it's going to create a suction. Okay, so you want to make sure. So that's working. Now I'm going to go ahead and open up my kit and get a pair of sterile gloves, and try not to touch a catheter. This one had 2 catheters. It should only have one in there. Oh, guess what? There's no gloves. Sterile gloves. Thanks,
What
gloves.
size do you need?
Remember, I'm allergic to latex.
Alright.
I need those green ones. Usually 6.5 or 7. But I'll put some nitrate ones in here. I got excited when I opened the thing. I thought there was gloves in there. Okay, I'm gonna take this one away. You guys are the first class that's ever recorded me. I'm camera shy.
I'm gonna be famous. I know.
No, it's good because then I can show the other students, the other classes, in case they guys can see it at home.
Yeah, I'm trying to do like smaller like videos so I can send it. 'Cause I tried to email it. I think it was too long,
Oh yeah?
and so I'm trying to do like smaller, like stop and go. So we'll see if that works.
Okay. All right. So here, I'm gonna start again. We're gonna grab our gloves here. Open this up. I'm only going to do one glove first because I need to open that up. Or you can do it beforehand. You can pour some saline in there. You don't have any suction tubing, do you?
There should be some right behind you. Inside the drawer.
Oh, in the drawer? No.
How about the drawer right there next to you? Yes. There you go. There it is. You have a winner.
Okay. So you want to make sure all of this is connected. Do you know if this regulator actually works, or it's just simulation?
Simulation.
Okay. So you can actually get your finger, put it here, and when your regulator, you're gonna look to see that it stays within 80 to 120 because you don't want it higher than that. Okay, so let's go now for the gloves. And also, if you expect this patient to have a lot of secretions coming out, make sure you use your proper PPE. So that would be your shield, your gown. And so I'm gonna go ahead and apply my sterile gloves. With this one, immediately, just like your Foley, you're gonna contaminate one hand because you have to touch other things. So you wanna decide which one's gonna be your clean sterile and your clean dirt, okay? So I'm gonna go ahead and use this one as my clean sterile. So I'm gonna use my catheter here. Now I'm going to contaminate. That's on. I'm gonna attach this to here. Okay, and I'm going to check it again. So make sure that it works. Yes, it worked. So now I'm going to tell Mrs. Smith that I'm going to go ahead and go in and suction. Make sure I'm not touching any of the sides. I'm going to go in. If she coughs or bucks, I'm still going to continue to push the catheter in. And then as you come out, you're going to go like in a rotation motion. And no more than 10 to 15 seconds. My paper says 10, but the book says 10 to 15. You don't want to do that. And allow them to take breaths in between. So clear it out again. Go back in one more time, okay? And go glide in smoothly, making sure your catheter is not touching gown or anything else. Now you're going to press suction. Come out. And you're going to take note of what's coming out, what it looks like. And even ask your patient, is that enough or do you want one more? Most of them, between 2 to 3 times you're going in, they're good with that. Okay, so I'm going to take this off, put this catheter in my glove, and dispose. And I'm going to document my findings, and of course reposition the patient for comfort, call light within reach. And let's say if this was all I was doing, then I would exit and go document. But because we're also going to do trach care, I'm going to stay in the room and continue doing my stuff.
Are we going to hyper oxygenate the patient?
Yeah, we did.
Before?
Yeah, we did.